Hello and welcome. Today we have a very interesting program, very interesting guest. But before I introduce her, I want to ask each and every one of you, when was the last time your doctor asked you about your dental health? If the answer is never, you're in for a surprise because what you're about to hear is going to really change the way you think and feel about health. So our special guest today is Dr. Ellie Campbell. She's a family physician practicing in suburban Atlanta for nearly 30 years. A native Chicagoan, she holds BS, MS, and DO degrees and is board certified in both family medicine and integrative medicine. She's on the board of directors for both the International College of Integrative Medicine and the American Academy of Oral Systemic Health, with a background in evidence-based community wellness and indigent healthcare. She recognized that that model failed her patients. And since 2005, she championed a solo concierge-style integrative, holistic, functional, medicine-based family practice. She's a member of the American Herbalist Guild, uses a variety of homeopathic, natural, and herbal medicine in her practice, and she lectures internationally on innovative medical practice design and management, community partnerships, functional medicine, bioidentical hormone replacement therapy, women's health, cardiovascular disease prevention, the oral systemic connection, and solutions to physicians' burnout and vitamin D, which we all need. You can learn more about her and her practice by going to campbellfamilymedicine.com or revolutionpractice.com. Ellie, welcome.
Thank you, Dr. Mastavoy. Nice to see you today.
Well, I want to start with, when did you discover that oral health or dental health is important in your practice?
Yeah, well, as an osteopathic physician, we're trained that body, mind, and spirit are one, and that you can't separate any one part of the body from any other part of the body. Certainly, musculoskeletal conditions are relevant to the osteopathic exam, and the temporomandibular joint is critical. So I've always sort of been in tune to that, but really getting into the teeth and the mouth and the palate, the gums, and how bad teeth can affect your health, probably about 5 years. I attended a couple of conferences at the International College of Integrative Medicine, was introduced to Dr. Simon Yu, who is an acupuncturist and medical doctor, and he uses bioenergetic techniques privy to the acupuncture world, known about it for thousands of years, relatively new to me though in my training. And making those energetic connections was really an important part. So I'd say about 5 years I've really been studying. Then about 4 years ago, I went to a conference with Brad Bale and Amy Doneen on their Bale-Doneen method. And we use blood markers to show signs of inflammation. And it is their conviction that no cardiovascular prevention program is complete without a dentist and hygienist on the team. And the markers of inflammation that are driven up that increase the permeability of the arteries and make them more likely to plaque, these markers of inflammation are often driven by dental conditions. So they sort of honed my focus on the dental aspect of medical disease. Once I started paying attention in my own practice, it was an aha moment that I'd been overlooking so much oral contribution to systemic wellness.
That's interesting. So if we are talking about periodontal disease, or let's say, gum inflammation or plaque, what's the connection between that and cardiovascular disease?
Yeah, so, if you ask a dentist what is plaque, they'll tell you, oh, it's a sticky protein that's on your teeth and it's got bacteria in there. And there's healthy plaque and there's unhealthy plaque, but bacteria are a significant driver for that. If you ask a cardiologist what is plaque, they'll say, oh, it's a sticky fluid inside your arteries that's made of cholesterol mostly and inflammatory markers. But we're now learning, because we have significantly advanced technology, that we find breakdown products of bacteria in plaque in arteries. So it's probably the same fluid that's on your teeth and in your arteries. New studies have shown us in the last few years that there's at least 5 specific oral bacteria that cause periodontal disease that also can make plaque in our arteries. Through 3 distinct different mechanisms, these mouth bacteria make plaque. More importantly than that, these mouth bacteria can actually cause plaque rupture. And so when somebody has a heart attack or a stroke, it's a sudden event, right? You are well 1 minute and then your face is drooping and you can't speak the next, or you're well 1 minute and then you have crushing chest pain, shortness of breath, and nausea. Those sudden events are caused by a blood clot in an artery, not by a cholesterol clot. So it's the blood clot that causes the sudden symptoms, and the blood clot is a result of plaque rupture most of the time. A plaque rupture is a sudden event where the artery gets something that pokes a hole in it, and this oozing mass of bacteria and inflammation oozes out through that hole into the blood flow. Body recognizes that, forms a blood clot over the surface, and if that clot is large enough, it will actually block the entire artery. So getting to the emergency room within 1 hour can save your brain. Clot busting drugs can be given in many cases and burst open that artery, burst that clot open, and allow the blood flow to recover, resuming blood flow to the brain and reversing the symptoms of the stroke. Sometimes reversing symptoms of the heart attack if you can get to emergency services quickly enough. Plaque rupture can be triggered by these dental bacteria. And in almost every one of my patients who has had a sudden change in their cardiovascular status, a deep dive into their history tells us that they have a dental problem going on, a toothache, or a root canal that's been festering, and they're seeing blood when they floss or brush their teeth. But if you don't know to ask those questions, you're going to miss it, because the emergency room doctors aren't tuned into it, the neurologists aren't tuned into it, the cardiologists aren't tuned into it. It's our job as primary care providers to be well tuned into it and identify it, because treating dental disease early can save your brain and save your heart.
And what's the connection between dental oral health and, let's say, breast health?
Yeah. So in my office, as a preventive health strategy, we offer thermal breast imaging, breast thermography, as a screening tool, as an adjunct to mammography. Thermography can find these heat signatures of abnormal breast activity well in advance of cancer. Well, what we learned was that when you find a woman that has a hot activity on her breast, and you raise the thermography camera just a little bit and get the image of her jaw on the same side, very often, in some studies, 90+% of the time, there's a hot dental lesion on the same side as the breast. So studies have now been conducted and suggest that maybe 90% or more of women who have breast cancer have a root canal or an implant on that side of their mouth, on the same side where their breast is. This is fascinating because when you go to the wisdom of the ancients and you look at the traditional Chinese medicine meridians, the acupuncture meridians, there's a map that you can make that connects various teeth to various organs. The 2 lower front teeth, for example, connect to the urinary bladder. The wisdom teeth connect to the heart, but the 2 molars in front of the wisdom teeth, they connect directly to the thyroid and the breast. So often we see infected, inflamed molars connecting directly to breast health. And we think that what's happening is that a root canal tooth is a dead tooth. It's sitting in the mouth, holding space, and there's always bacteria on it. A root canal tooth is never sterile. It's dead and it has bacteria on it. But if your immune system is strong, you can keep that under control. You can keep that tooth in your mouth and you can continue to have a healthy life and everything seems to be fine, recognizing your immune system's running on a treadmill, making sure that that stays under control. Well, if your immune system is spending all of its resources here and you have a breast problem, it may not be able to respond to that breast lesion, and it can accelerate in its seriousness because the immune system is distracted. We then, if we see a hot spot on a thermography image, then we get the patient to the dentist urgently and we say, let's do a Panorex x-ray, or let's do a cone beam CAT scan, or let's take a biopsy of that tissue of the jawbone and see what's going on there, because, or we can do a bioenergetic scan and see if bioenergetically the tooth is a problem. Sometimes some ozone treatment can be done to sterilize the tooth, and the tooth does not need to be removed. But in many cases, the tooth does need to be removed. And I've had a few opportunities recently to have patients have these teeth extracted. And there's a new company that, relatively new company, that does DNA analysis of infected teeth. So the patient brought their teeth to me from the oral surgeon. We properly prepared them and froze them and sent them off to the lab. And then we examined the teeth for bacteria. And it was a teeming mass of 21 different types of bacteria, fungus, and amoebas, parasites, living in the tooth root. Clearly, that's a strain on your immune system if there's a polymicrobial infection like that, dampening your immune system's ability to respond to other things going on. So there's a huge connection between the mouth and the rest of the body, and specifically the breast and those first and second molars.
So as our friend who introduced us to this, Dr. Saman Yu, would always say, it's not a dental problem, it's a medical problem now.
Yes, correct.
I want to ask you about, since you mentioned TMJ, what's the connection between TMJ and overall health?
Yeah, so I had the unfortunate accident 3 years ago in which I was rear-ended by a semi-truck, and he left me with a concussion and 3 herniated discs in my cervical spine. For the first time in my life, I developed TMJ symptoms and coincidentally had my final menstrual period about the same time. So I hit menopause at the same time that I ended up with a concussion. Well, the muscles that go from the top of your head to the back of your scalp and down your neck also innervate the jaw muscles. And so when you have a whiplash type injury of your neck, you very often will develop a muscle strain pattern that pulls the TMJ out of alignment. When the TMJ is pulled out of alignment, and by the way, that jaw joint is very sensitive to estrogen. And so at the time of menopause, you're more susceptible to this because of dropping estrogen levels. The TMJ no longer rides smoothly. When the TMJ clicks and pops and your teeth don't sit right, it can result in physical symptoms such as headache, nausea, jaw pain. It can cause insomnia. It can cause brain fog. All of these things I had, and I was thinking they were related to the concussion, and in part they were, but there was also a contribution from the TMJ. So getting my being a chiropractor and seeing a craniosacral massage therapist to get the strain pattern reversed from my neck, scalp, and TMJ was an important part of my recovery, and has made a huge difference. My teeth sit properly now. They weren't, but my bite was off from the TMJ. And it's nice to have that all settled back in normally.
Another huge thing when it comes to oral cavity is sleep apnea. A lot of people suffer from it. They may have symptoms. So many people know, and many people, even probably a greater number of people, don't even know that they suffer from sleep apnea.
Yes. One of the biggest clues to sleep apnea is snoring. If your bed partner makes funny noises, a typical pattern is snore, silence for a long period of time, and then that sort of a pattern identified by a bed partner is almost always sleep apnea. But not everybody that snores has sleep apnea, and you can also have other types of sleep apnea with no snoring. So we look deeper. We ask questions about, do you wake up rested in the morning? When you fall asleep, do you fall asleep and stay asleep easily? Do you have to get up to urinate? This is a really important symptom, especially for central sleep apnea, because if your brain does not get into deep restorative REM and delta wave sleep, your brain does not tell your kidneys to stop making urine. As a result, you continue to make urine all night long and you have to get up and go pee. Whereas if you are reaching deep restorative sleep, that signal is sent, stop making urine, patient sleeps the night, and no need to void occurs. So we have to ask the right questions. Do you go to sleep easily? Do you stay asleep easily? Do you wake up multiple times in the night? Do you hear yourself snore? Do you have muscle pain or fatigue upon awakening? You have to sit up on the side of the bed and grease your wheels in order to get moving. If you have all that morning stiffness, you are not achieving deep restorative sleep. And these are clues that you have sleep apnea. Many people are afraid to mention sleep apnea because we know that if you fall asleep at the dinner table after meals, you may very well have not gotten a good night's sleep. If you fall asleep in watching television, if you fall asleep driving a car, this is a horrible symptom, can result in accidents. Truck drivers know that if they are diagnosed with sleep apnea and not treated, their licenses are revoked until they become treated. So they keep it a secret. They don't want to tell anybody because often the evaluation takes so long and they lose their livelihood in between diagnosis and treatment. So we're getting better at doing that for patients. There are many clinics now that have truck stop diagnostics where you have a sleep study where you're diagnosed and treated all in the same night. And that's a lovely thing if CPAP mask is your treatment. Many people are afraid to get tested for sleep apnea because they're afraid of a CPAP mask and they don't want that. So they want to know, what else do we have? Well, the new sleep masks are better than they ever used to be. And the machines are smaller than they ever used to be. Many of the machines are maybe that big, not much bigger than a wallet. So it's not a suitcase that you have to carry on the plane like it used to be. But our dental experts, our dentists, are getting into the sleep study world because a simple examination of the mouth can clue you in that there's a sleep problem. When you open your mouth, there should be a wide space between your soft palate and uvula, that little thingy that hangs down in the back, and the base of your tongue. When you open your mouth, if your uvula touches your tongue, or if your tongue is so big and tall that you can't even see the uvula, we have a rating score for this called Malampati, and the dentists are always looking at this. Now that they recognize it, they're starting to do sleep studies themselves because many dental treatments are now available. In my day, when we were teenagers and had orthodonture, it was common for the dentist to extract 4 teeth from us, the premolars. They did that to straighten our teeth, and that was lovely, but the problem became that our whole mouth, all the rest of the teeth moved forward, and it became too small for our tongue. So now we have an obstructing tongue that doesn't have enough space in our mouth. Dental appliances can help to open that space, give you a wider jaw, make room for your tongue. Some ears, nose, and throat surgeons have a procedure where they can move the hyoid bone forward and make more room for your tongue. It's a big surgery, but it's an option besides a CPAP. And there's a device that's like a pacemaker for the diaphragm that can be surgically implanted, and it sends a little electrical signal to your diaphragm to pull it down while you sleep, so no CPAP is required. I'm not suggesting that any of these are perfect for any patient, but they are options on the table because it's the assumption by most people that there's one and only one treatment for sleep apnea, and that's certainly not the case.
Right. I wish we had kind kind of an ability to get dentists and physicians to communicate and to work together. Generally, that's not the case, unfortunately.
Yeah.
Because physicians don't look into the oral cavity, and dentists are not really allowed to say anything or do anything outside of the oral cavity. But speaking about that, can we address one more thing? Inflammation in the oral cavity, inflammation in the gums, because that's also huge, kind of also very, very systemic when it comes to medicine.
Yeah, I mean, people think that if they have inflammation in their gums, it's just a dental problem. It's not going to be an issue. Well, I'm here today to tell you that over and over and over and over in my practice, I see rheumatoid arthritis symptoms improve. I see Crohn's disease improve. I see autoimmune thyroid conditions improve. I see depression and anxiety improve. I see insomnia improve when we get the mouth inflammation under control. How do I know there's mouth inflammation? Well, two primary ways that I use are physical exam and laboratory data. So a couple of laboratory markers clue me in that there's an oral problem. One is called high sensitivity C-reactive protein. When I see CRPs elevated or sedimentation rates elevated, or cardiovascular markers of inflammation such as F2 isoprostane or myeloperoxidase or LPPLA2, big fancy blood markers, I know there's an inflammation problem, and often the inflammation's in the mouth. It's the first place I look. The second way is physical examination. If you look at the patient's teeth and their gums are red and puffy, they have an inflammation problem. If they brush or floss and there's pink in the sink when they spit, this is a 911 dental emergency. You need to get to your dentist right away and say, I heard that pink in the sink means I have gum inflammation, and I know that gum inflammation can affect my brain, my heart, and my immune system, and I don't want that anymore. And the dentist should be able to take you in, do a thorough examination, a deep cleaning, and then talk to you about ways to change your home care regimen to reduce those bacteria that are causing inflammation. So we have a broad spectrum of ways we do that, from oral rinses. Sometimes we use bleach water, sometimes we use frankincense, sometimes we use over-the-counter rinses. Closis is one that is a brand name that we sometimes use. Sometimes there's something called a perio tray. It looks like an orthodontia retainer, and they put a peroxide gel in it and throw the retainer for a few minutes a couple times a day, and that can eradicate it. Some dentists are good at using ozone treatments. So there's lots of opportunities to make these bacteria go away and to shift it. Now, I also would say that no periodontal dysbiosis is present by itself. Almost always there's a gut dysbiosis at the same time. The patient's GI tract is also out of balance, leading to their mouth being out of balance. So being on a healthy diet with 9 servings of fruits and vegetables every day and getting a good broad range of antioxidants, a color of the rainbow in the fruits and vegetables that you eat every day, possibly eating a probiotic for your gut or chewing a probiotic specifically for your mouth. These are all ways that we use to take that inflammation out of your mouth to protect your brain, your heart, and your immune system.
That's great. Listen, I wish we had more time. You're a treasure trove of information. And I'm so glad that you actually brought up the subject of, oral health and gut health, because it's the same cellular kind of structure that starts from our nasal cavity and goes all the way down to epithelial cells, all the way to the rectum. Even sinus issues are connected to your gastrointestinal tract. Maybe we can get you back again.
There's so much more to talk about. We didn't talk about genes. We didn't talk about drug nutrient depletions. We didn't talk about cholesterol particles. We have so much more to talk about, Dr. Mostaboy.
That's it. We're doing this again and again and again. Thank you so much. I really appreciate it, and I'm sure everyone who is going to listen to this is just going to kind of say, wow, this is important. This is very important. Thank you so much.
If there's practitioners in your audience, please think about coming to the Roots of Toxicity Conference in Dallas in March. This is an interdisciplinary organization with medical and dental groups. And we would love to see dentists come there. Start paying attention because there's many interdisciplinary groups that exist. On my websites, we'll list them, and we would love to see interested people join our conferences and spreading the word about the oral systemic connection.
Perfect. Thank you so much.
You're welcome.
Take care.